Good morning. There are a lot of precautions workplaces need to be taking to protect workers from the virus causing COVID-19, and cleaning and disinfecting is important for every workplace. I'm Angela Bozzato, a training service representative with the Workers' Health and Safety Center, serving workplaces in the Greater Toronto Area. As Ontario's designated health and safety training organization, we deliver a wide range of classroom and now virtual classroom training courses to assist in protecting workers' health by making workplaces safer. We've been producing this weekly webinar series to help get information to you about how to fight this pandemic in your workplace. And we also have a 3-hour virtual classroom course, The Hazards of COVID-19, that you might want to register for. It's only $10, and you can register on our website at WHSC.on.ca. In previous webinars, we've talked a lot about the characteristics of the virus, how it uses us to replicate and spread. We've reviewed how workplaces can use distancing, hand hygiene, and masks. Today, we'll talk about cleaning and disinfecting workplace surfaces. First, to understand why cleaning and disinfecting is so important, we'll review how this virus spreads. We'll look at differences between cleaning and disinfecting, the different products and their hazards. We'll look at some safer alternatives and procedures for safe cleaning and disinfecting. In this webinar, we will focus on preventing the indirect spread of COVID-19. This happens when we touch contaminated surfaces and then our mouth, nose, or eyes. The virus remains viable on surfaces for hours or even days. Let's look at a recent study that shows us how long it can remain infectious on various surfaces. In this study, published in the New England Journal of Medicine, researchers compared the stability of the virus causing SARS-CoV-2 virus with the stability of SARS-CoV-1, the coronavirus that caused the SARS outbreak in 2003. The results indicate that SARS-CoV-2 is viable for longer periods, up to 72 hours on plastics, 48 hours on stainless steel, 4 hours on copper, and 24 hours on cardboard. What about other surfaces? And how do temperature and humidity affect the viability of the virus? These seem like very simple questions, but the answers are not yet available. We must continue with our efforts to prevent the spread in our workplaces by promoting good personal hygiene, hand hygiene in particular, and effectively cleaning and disinfecting work surfaces. It's important to distinguish between cleaning and disinfecting. Cleaning removes dirt and impurities from the surfaces, but it does not kill germs such as the COVID-19 virus. Disinfecting uses chemicals to kill germs that remain on a surface. Cleaning and disinfecting are two separate processes. Clean first to remove dirt that can protect germs, then disinfect to kill the germs. So to be effective, we need to do both clean and disinfect workplace surfaces. Employers, in consultation with the Joint Health and Safety Committee or health and safety representatives, should develop proper cleaning and disinfecting procedures and programs. Cleaning can be done with soap or detergent and water using a damp microfiber cloth. We need to take care in selecting cleaning products. Soaps and detergents, although cleaning and disinfecting have increased due to the pandemic, concerns on adverse health effects of cleaning and disinfecting products are nothing new. Unfortunately, the health of many workers can be hurt by soaps and detergents. By law, all chemicals coming into the workplace must have WHSC labels and safety data sheets. And the data sheets need to be kept in a place where they are readily available to workers. Workers using these products and their supervisors should review the sheets. Joint committee members or health and safety representatives should also read safety data sheets so they are familiar with the hazards and possible health effects of cleaners used in the workplace. But let's remember, that reading a safety data sheet or seeing a WHMIS label doesn't help much if workers aren't able to use the information for their protection. WHMIS training is mandatory for all workers who work with or near any WHMIS controlled product. We at the Workers' Health and Safety Center offer WHMIS training. You can register from our website at WHSC.on.ca. The WHMIS regulation requires that employers train workers on the purpose and significance of WHMIS labels and safety data sheets, and they need to regularly review workers' knowledge. If knowledge has faded, the law requires retraining. Safety data sheets will provide information about safe use of cleaning products, including all personal protective equipment that needs to be used. Employers need to make sure that PPE is appropriate to the hazard and fits the user. Joint committees and safety reps should also read the WHMIS sheets. If the product can be harmful, do a little research to find a less hazardous product and raise it to your employer. Remember, employers have a legal duty to take all precautions reasonable in the circumstance to protect workers. So if there's a safer alternative product available, that's what the law says your employer should be using. It's very convenient to name these products disinfectants. It certainly sounds better than disinfecting pesticides, but that's how the United States Environmental Protection Agency classifies them. They are hazardous products and they create hazards in the workplace. But in this pandemic, they now must be used in all workplaces. There are many types of disinfectants. Here's a few. Do any of these sound safe to you? This is not a complete list. There are many more dangerous chemicals than these products. Yes, we need to disinfect surfaces to protect us from the spread of COVID-19, but that doesn't mean that disinfecting products are safe. Let's discuss the health effects of using disinfectants. They can irritate the eyes, respiratory system, and skin. They can also cause many other health problems, including cancer. Each chemical used to create a disinfectant product has its own hazards. Often, the combination of chemicals are more hazardous, and we lack information on the impact on human lives. Cleaning and disinfecting has been standard practice in healthcare facilities for a long time, and healthcare workers are usually experienced with process and products. But even with controlled programs and trained and experienced staff, cleaners and disinfectants can result in health harm. For instance, a study of over 73,000 nurses in the US suggests that disinfectants use risk of nurses developing COPD increased by 25 to 38%. This, unfortunately, is only one example of the effects on workers and the use of disinfectants. By the way, these studies I'm mentioning are all footnoted in the notes in this presentation, which will be posted to the Workers' Health and Safety Center website by tomorrow morning. You'll receive a follow-up email with the links. Now that the use of disinfectants isn't only a healthcare setting, many workers are being exposed to hazards they had no experience with. Proper training in the handling and use of disinfectants is necessary, but not all that is required. A lot of information listed on this slide can be found on your safety data sheets. But it is important to remember that when you mix chemicals, you can get a reaction that changes the chemical and changes the health effect. Like anything else, the internet is filled with wrong or misleading information. It is vital to find reputable websites for accurate information. The same goes for cleaning and disinfecting products. A site that we can recommend is the US Environmental Protection Agency site, which has a list N, of approved products for killing COVID virus. All products are given a registration number, making it relatively easy to verify on EPA website. The disinfectant's product label should have an EPA registration number on it. Enter the first two sets of that number into the search bar and it will give you the information about the product. We can also recommend a similar list on Health Canada's website. It uses the drug identification number of the product, which should be on the product label. However, the Health Canada list doesn't state which products are safer for humans and the environment. But remember, safer does not mean safe. The EPA is considering rules for new uses of currently registered active ingredients, including the use of electrostatic sprayers to disinfect large indoor spaces. Electrostatic sprayers work by charging the antimicrobial liquid as it passes through a nozzle. The positively charged antimicrobial droplets are attracted to the negatively charged environmental surfaces, allowing for improved coverage on hard non-porous environmental surfaces. The EPA has a list of disinfecting products with safer active ingredients. You can use that list to find safer products. Wherever safer products are available, employers should use them. Joint committee members can help provide this information to their employer. Many disinfecting products contain quaternary ammonium compounds, or quats. These workhorses of modern disinfection have been found in consumer products for decades. But in the last 10 years, scientists have linked quats to reproductive and developmental problems in animals and found they can disrupt key cellular processes. So far, there's no data linking the compounds to toxicity in humans, but some scientists say there's more to be done to fully assess quat safety. If you're looking up a product and find that it contains quats, keep in mind there is some concern about them, though their harm is not firmly established yet. TURI, the Toxic Use Reduction Institute, has compiled a product list from the EPA's List N that has safer active ingredients. The products on this list are safer for disinfecting surfaces, safer for the user, and those who occupy the space. TURI eliminated products that were marked both cleaners and disinfectants because, remember, cleaning and disinfecting should be two processes. Clean to remove dirt that may protect germs, then disinfect to kill the germs. Regardless of the product, manufacturer's instructions must be followed. If you have a product available that is not on the registered Health Canada or EPA list, it may still be effective. Have a look at the label or safety data sheet for active ingredients. The following concentrations of active ingredients have been tested as most effective: 62 to 71% ethanol, also known as ethyl alcohol, 0.5% hydrogen peroxide, or 0.1% sodium hypochlorite, which is bleach. If you don't have pre-measured disinfectants at your disposal, that's okay. You can prepare a bleach solution of your own, but please take great care when you do. If you haven't prepared a bleach solution before, do it with someone else who has experience. To prepare your own bleach solution, add 5 tablespoons or a 1/3 cup of bleach into a gallon of water, or 4 teaspoons of bleach to a quart of water. Please note, do not mix any cleaning chemicals, as they may create a hazardous or even deadly gas. Bleach, if mixed with ammonium or any other cleaner, can be deadly, and unfortunately workers have been killed from the toxic gas released from this reaction. Also very important, ensure the bleach you are using is not expired, as it may not be as effective. Whether you are using a common household disinfectant, medical grade disinfectant, or a bleach solution, all are hazardous products. They can only be handled by a worker who has been WHMIS trained and can use the sheets for self-protection. The safety data sheet will provide needed information such as recommended dilution, material compatibility, storage, shelf life, and safe use and disposal. With all our products gathered, We now can look at what you should do next before you start cleaning and disinfecting. First, make sure the area is ventilated. Ventilation is needed to minimize exposure to respiratory droplets. If possible, open outside doors and windows to increase air circulation or increase the building's air exchange rate at least 30 minutes before cleaning. In areas where someone has worked or visited and has been identified as a person suspected, presumed, or confirmed as infected with COVID-19, you should wait at least 24 hours before cleaning and disinfecting. For all cleaning tasks, include handling trash. Workers should be supplied with gloves that fit properly and give appropriate protection from the disinfectant. Use a gown, or if not available, use coveralls, aprons, or work uniforms. A face shield can be used to block any splash from hitting your face. Use shoe covers, or dedicated shoes that can be decontaminated. Prior to any cleaning tasks, training on proper use and limitations of personal protective equipment should be provided, including putting on or removal of PPE, proper disposal, and how to properly clean, decontaminate, and maintain reusable PPE after and between uses. Workers should always inspect your PPE immediately before use and report issues such as a tear in gloves or any potential exposure to your supervisor. Employers should supply a fit, tested, and N95 respirator or higher level respirator protection, such as a powered air purifying respirator, a PAPR. If cleaning and disinfecting are an area where suspected, presumed, or confirmed persons with COVID-19 worked or visited. Most important, personal protective equipment is just part of a complete array of safeguards that must be taken to safeguard the health and safety of workers doing the cleaning. Measures such as physical distancing between workers and the public must be considered and in place. Among other things, workers must also be supplied with hand washing facilities and time to complete this task frequently and thoroughly. For more information, check out the Workers' Health and Safety document posted to our website and titled Safeguards for Workers Confronting COVID-19. At this point, you have all your products. You reviewed their safety data sheets and manufacturer's instructions. You've opened doors and windows where possible. You've been trained and are wearing your PPEs. Now is when you can start. For hard surfaces, use soap and water. Wipe the surface using friction with disposable or microfiber cloth. Tests show microfiber cloths tend to be more effective at cleaning and disinfecting than terry or other types of cloths. It is important to ensure the cloth stays clean by using a new cloth or a fresh portion of the cloth for each area or surface. Once all portions have been used, the cloth should be replaced. If you are using reusable cloths, it may be a good idea to color code the cloths. For example, use red for bathrooms, green for frequently touched surfaces, and blue for glass or reflective surfaces. It's important to ensure only one set of cloths is used per room or area to avoid cross-contamination. After you've cleaned the area, now disinfect the surface. Very important when you review your safety data sheets and manufacturer's instructions, they would have indicated how long the product must remain wet on the surface to be effective. Generally, the disinfectants must wet the surface for between 1 and 10 minutes. It's important not to forget about soft surfaces such as linens and cushions. Fabrics that are potentially filled with germs should be washed in hot water with detergent and dried at the highest temperature setting available. For non-washable soft surfaces like carpets and furniture, you can apply a disinfectant spray. Electronic devices such as touchscreens, keyboards, ATM machines, remote controls, and input pads are frequently touched surfaces. To make them easier to clean, consider if covers can be put over them that can be easily wiped. If you do not have these, ensure to follow the manufacturer's instructions, and if cleaning instructions aren't available, use an alcohol-based wipe or spray that have 70% alcohol and then dry the surface thoroughly. Disinfecting wipes have been flying off the shelves during this pandemic. While these wipes are very handy, like all disinfecting products, be sure to check the Health Canada or US Environmental Protection Agency website to see if they are effective at killing COVID-19. If they're not on the list, again, check their active ingredients. There's no point using a disinfectant that does not kill the virus. It is also important to use correctly. First, you should clean the surface prior to using wipes. Now, check the container, as it will indicate how long the surface must stay wet. If you grab a wipe and give a counter a quick swipe without cleaning and without ensuring the disinfectant remains wet on the surface for the required amount of time, you may be doing more harm than good. You may just be smearing the pathogens around. Dry wipes should be discarded as they are no longer effective. Wipes are useful when using between cleaning and on items frequently touched. Cleaning can also include removing waste or emptying waste bins. Things such as discarded cloths, gloves, or tissues in waste bins may contain the COVID-19 virus, so care must be exercised. Waste bins should be lined with plastic, and ideally waste bins should be non-touch or open. After you remove the bag of trash, you should clean and disinfect the waste basket at a minimum. Spray it with a disinfecting spray. Once you are finished cleaning and have emptied the waste bins, the waste bin and all the equipment used, such as brooms, mop handles, etc., must be cleaned and disinfected so they are ready for next use. Clean and disinfect the broom or mop handles just as you would a hard surface. Cloths used should be discarded, or if they are reusable, placed in a bag until they can be laundered. PPE such as gloves and gowns should be removed properly and immediately disposed of into an empty plastic-lined non-touch waste bin. If using reusable gloves, they should be properly cleaned and decontaminated. It is imperative that you immediately wash your hands with soap and water for at least 20 seconds after removing gloves. If soap and water aren't available, then you should use hand sanitizers with at least 60% alcohol, ethyl or isopropyl alcohol. Workwear worn should be laundered daily, and as an added precaution, you may want to remove workwear and place it into a plastic bag until it can be laundered. I hope this presentation has brought you up to date on research about cleaning and disinfecting uses in the workplace to protect ourselves and each other. This webinar is one in a series we've developed to help keep you, your workplace safe throughout the pandemic. If you want to download this or any of our COVID-19 presentations, go to our website, WHSC.on.ca. A video of this and all our webinars will be posted to our YouTube channel, WHSC Training. This PowerPoint will be posted to our website. Also, on our website, you can find the Workers' Health and Safety Center fact sheet about enhanced ventilation and many other useful fact sheets. You'll get a follow-up email tomorrow morning giving you the exact links. In addition to this series of webinars on COVID-19, the Workers' Health and Safety Center is now offering virtual classroom training. We've modified a number of our most popular programs so they can be delivered via virtual classroom, including certification training for Joint Committee members and WHMIS. Recently, we added a course on the hazards posed by the virus that causes COVID-19. You can register for our virtual classroom training on our website or by contacting me or any of our training service representatives around the province. Here's our contact information. You can also follow the latest developments via Facebook, Twitter, or LinkedIn. Let us know how we did today by completing the poll posted on your screen. Let's now take a look at some questions that came in earlier on. Questions that were submitted during the presentation will be answered through email. So our first question, how often should workplace surfaces be cleaned and disinfected? Frequently touched surfaces should be cleaned and disinfected at least twice per day. Next question, what PPE should be worn by those cleaning and disinfecting? Gloves compatible with disinfectant products being used, ensure proper fit, face shields if there is a potential for splash, disposable gowns, or if gowns are not available, coveralls, aprons, or work uniforms can be worn. Shoe covers or dedicated shoes that can be decontaminated, fit-tested N95 respirators, or higher level respirator protection such as a power air purifying respirator, if cleaning and disinfecting an area where a suspected, presumed, or confirmed person with COVID-19 worked or visited. Next question. Should workers tasked with cleaning and disinfecting be trained on how to clean and disinfect? Yes. Besides being GHS WHMIS, workers should be trained on how to use the required PPE properly and how to clean and disinfect surfaces safely and effectively. We cannot assume everyone knows how to effectively clean surfaces. And our last question, what should a worker do if they start feeling unwell due to exposure to cleaners or disinfectants? Report how you're feeling to your supervisor immediately and follow the manufacturer's first aid recommendations listed on safety data sheets. And if necessary, seek medical attention. This concludes today's webinar. Thank you for watching. Stay safe and stay healthy.